Okay, so some things I think you did well today. Your patient communication was really good. You're really clear and concise when you're talking to the patient, letting them know when you're about to perform an assessment or anything of that nature. Even with exercises, you're clear and concise, telling them how many reps, how many sets they need to do. And I thought you did a really good job with your patient communication. Another thing you did really well was your demeanor in the clinic. You're very confident and you present yourself well, very professional, and you have a good therapeutic presence with your patients. And today you really took a good history. You were very thorough with your history, highlighting all the aspects that you needed to perform when taking your history. Some things I think you can improve upon would be your documentation. You didn't get to fully document today, so you probably can improve upon that and just really understand the different aspects of the documentation. Your exercise selection, I felt that some of the exercises you picked were a little too easy or basic for the patient because it seemed as the patient could do it very easily. And then one other thing I feel like you could improve upon would be your patient education, because I did hear that Dr. Shamish was helping a little bit with that. I feel like you could just try to initiate that yourself a little bit, but overall you did really well today.
Okay. I also Okay, Chris. So I'm going to start with some of the things that I saw that you did very well today in the clinic. The first thing is your exercise selection. I thought that you were choosing very good exercises for the diagnosis, and I thought that all the components to it, your dosing, your reps, your rest, your sets, all of that was very well performed. Also, I thought that you were doing a very good job with your explanations of what to expect from the exercises. For instance, the one patient that you had where you were performing the glides on, you were explaining very well what you were about to do to the patient, what they should feel, how they should respond to it, and things like that. Also, while going back to that same patient, your communication was very well. You were making sure that you were in a position to where you were able to see the patient's face, you were making eye contact while you were talking to them. I thought that was all very well. Also, your communication with Dr. Shamish was very well. When you had any questions, you would always go to her to make sure that you were doing things correctly. So I thought that was all very well. Now, some of the things that I think that you can improve on, one thing would be engaging the patient while you guys are in between exercises. There were certain times that I felt like there was dead space where you could have been talking to the patient or maybe educating a little bit, which that's another thing. I also think that you could have improved on patient education a little bit. Like if a patient had a question, you could be there to answer it right away rather than having to double check with Dr. Shamish or Dr. Pfister. So that's another area where I think that you could improve a little bit. And then also lastly, I think your documentation, I think that you could have been a little bit more thorough when you were doing it. I feel like you gained a lot of information because you were doing very good evaluations throughout the treatment, where you could have actually added that into your documentation to have it a little bit more thorough. And also the time spent documenting. I thought that you could have went a little bit faster, and it would have been better for productivity that way, because in real life you're going to be having multiple patients at a time. So I think that that's one area you can improve. But other than that, I think you did a really great job.